I'm Jude. Welcome back to Reborn at 69. 9.5 months ago, I had plastic surgery. I had 5 procedures done, had the throat, the face, the temporal brow lift, the lip lift, a little revision on the upper eyelid, upper cleft, and I feel terrific. I have a little secret. A couple days ago, I had a big birthday. I turned the big 7-0, and I am just so happy with the way that I look and the face that my doctor gave me. Dr. John Paul Azzi is a double board certified facial plastic surgeon. His main office is in Jupiter, Florida, but he also has a satellite office in Palm City, Florida. And recently I met him at that office. He was kind enough to grant me a half hour, and I interviewed him directly and asked him some pointed questions that I keep receiving. And these are pretty universal questions, so I think you're going to enjoy hearing them, hearing his wonderful responses. I learned a lot, and I thought I had become pretty educated in the process, but his answers are very insightful and very, very interesting. I'm not a paid promoter for Dr. John Paul Azzi. I am just someone who is very, very happy and actually thrilled with the results of my surgery. And I just really want to help more women experience the joy that I experience every day when I wake up and I see my face. Let's get started with the doctor. Question number 1, how do you know if someone is a great candidate for the facial plastic surgery, the facelift, which includes the throat? And how do you know if someone's a great candidate for a lip lift? So let's hear what the doctor has to say.
So that's a very good question. So the best candidates for all the procedures I do are usually people who have certain aging problems, and they're in certain age ranges. So for example, for the deep plane facelift, which is an actual repositioning of all the deep tissues in the face, best candidates are really anybody who have jowls that bother. If the jowls are coming down, you're losing the heart shape of your face, that makes you a pretty good candidate. Now, some people aren't as good as others. Somebody who's thin, has a very, tight neck goes very far back, their trachea isn't prominent or anterior, meaning forward, they're going to be better candidates. They have better skin, they'll be better candidates. Some people have natural heart-shaped face, makes them an even better candidate. Some people are a little bit more round, or they have forward tracheas, meaning that this is forward, there's not a lot of room to tighten it. They're going to be not as good, but they'll still get a lot of improvement if they're, as long as they're okay with being a lot better, but imperfect. Candidates for that are people who have decent volume and they're just genetically long or long from aging. Gravity pulling the lip down, gravity pulls everything. So everything will move towards the earth. So anyone who has a cupid's bow that has moved down, it's covering their top teeth, kind of like hanging like that, they're going to be a good candidate because they'll be lifted, they'll have good volume, a great shape, a very natural appearance. It'll make their face sink. So sometimes things get out of sync. These proportions are a certain length, and you have a very petite, small woman and a very long lip, sort of, more appropriate for a man who's 6 feet tall or even taller sometimes. They're a really good candidate. You lift their lip, you sink their face, and it makes a huge difference for them.
Okay, the next question is one that I get all the time. You look so natural. Your face doesn't look tight. You don't look pulled. You don't look like other people that I've met that have had facelifts. And I always say, well, did they have a deep plane facelift? And of course, the average consumer may not know what their friend or relative had. They just know that they had a facelift. So I asked Dr. Azzi, can you explain in layman's terms what the difference is between what I had, which is a deep plane facelift, and what was very common even 5 to 10 years ago, a smash facelift? And this is what he had to say.
That's a very common question I get. That's probably the thing I talk about most in consults is what is the deep plane facelift and how is it different and better than other facelifts like a skin lift or a smash lift, or smash plication is another thing people call them. So a good analogy that I use is sort of a construction analogy. So the deep plane facelift is like actually repairing the walls, the structures, the beams, the ceiling, the deeper things to the paint, basically, the things that hold up the ceiling. So it's structural, it's one level deeper. The other lifts are more working on the paint, like a skin lift is just the paint coat. So you would never try to hold up a ceiling that was collapsing or a weak structure with just using the paint. They won't hold up, and eventually everything will kind of collapse and sag and you'll have a little bit of trouble with it. So that's a very common thing we do revisions for, people who have had those types of lifts. A smash plication is when the muscle tightens. So you kind of crunch up the muscle with sutures and it sort of tightens it, but they usually fall pretty quick, and then you can get the visible scarring and the pulled down earlobe, which is called a pixie ear. With a deep plane facelift, this entire sheet of muscle going all the way down to the neck, put back where it used to be, secured in place, it heals, everything's tailored so it fits. Incisions are almost invisible, recoveries are very quick, almost no pain involved. And it holds up a really long time with a very natural appearance because it's what you were. It's an appropriate repair. So you have gravity pull the muscle down, deep plane facelift puts that gravity back where it was, and everything looks natural, lasts a long time.
Knowing now what I know about deep plane facelifts, I wouldn't even consider having any other. I know, and I've seen on the internet, that there are places around the world, including Mexico, where you can go and you can get a quote facelift for less money. However, they don't last that long. And I see the people interviewed on there saying that they were there 6-7 years ago, coming back and they're having it again. That's not a deep plane facelift. Deep plane facelifts last 10 to 15 years. So keep that in mind and be careful that you don't get lured in because of the price point to having a more or less an older technological type of facelift, which would be that SMAS that he explained, versus the newest approach, which is the deep plane. One of the big attractions for me to Dr. Jean-Paul Azzi, out of all the plastic surgeons I interviewed, was the fact that he was the one that was going to do the procedure without putting me through general anesthesia. And that is a big consideration. So I asked him, why do you believe in offering facelifts without general anesthesia? That seems to be sort of your signature, and how you, even above and beyond your skill, how you attract people from all over. And this is what he said.
So one of the biggest things people ask me about, and probably most people who travel out of state, about probably the top 2 reasons they'll travel out of state, is because I do these things without general anesthesia. So that means that we have eliminated essentially the risk of anesthesia, which includes coma, death, drains, long recoveries, nausea, vomiting, things like that. So these can be done now basically with oral sedation and local anesthesia. So people come in and they take tablets, they'll feel very relaxed, almost asleep, a few injections to make them numb wherever we're working, and then the procedures are very quick and smooth. So these things can be done this way, partly because I do nothing but facial plastic surgery, so I'm very comfortable, and the procedures are smooth and quick and very routine for us. And then also, it's just over time, the procedure has been perfected, and I've kind of developed these techniques to make things as easy as possible and as safe as possible on people. So you can have a very quick recovery. Stitches out in 5 days. A lot of people look good in a week. Sometimes can be remarkably fast. Some people feel like the smaller procedures, lip lifts and eyelids, sometimes they feel like they look good just within a few days with icing.
The last question, and probably one of the most interesting questions, was how do you pick from all the different procedures that are available to you in your toolbox? How do you pick and suggest different procedures for a client? And how do you select those that you think will be the most effective in helping them to look the way they want to look and create the vision that they want to create for their face? And his answer was fascinating. This is what he said.
So choosing procedures is very important, and that comes with sort of the artistic eye of the surgeon and experience of the surgeon. So if you find somebody who only does faces and does very, very high volume like I do, they will get very good at, within 20 seconds, identifying what I call the low-hanging fruit. So anybody can do every procedure. Everybody who comes in, you can recommend 10 different things, but everybody I find has low-hanging fruit. And what I mean by that is 1 to 3 or 4 things that are really causing 85% of their aging problems. And if you identify those things and you just treat those things, you can have people recover very quick, simpler procedures that don't take as long, and they get almost all of their benefit, because there are some things that society doesn't see. So you can spend all day chasing little lines or little asymmetries, and they don't make a huge difference for aging. A lot of it is big picture. So when I say low-hanging fruit, if you sink a lip and you make a jawline straight, you get a heart shape, things fit. If somebody's eyes are baggy, they'll look aged, they'll look tired. You can, improve those things. If somebody has a kind of a severe amount of skin hanging over, you can, do a blepharoplasty and trim their eyelids. So that's something that everybody has a few things usually that are kind of the biggest things. And I like to be practical, and I just pick the low-hanging fruit and I recommend it to them. And most of the time people kind of see it the way I see it, which is more of a practical light.
I hope you've enjoyed watching this great interview, this Q&A session with my doctor, Dr. John Paul Azzi. And keep watching. Please subscribe. Please hit the like button. We're working very hard to grow the channel. We will be covering other anti-aging and aging-related issues. We'll be talking about beauty and style. And I really appreciate your viewership. I really appreciate you sharing and letting your girlfriends know and your guy friends. And I really appreciate your loyalty. I don't take it for granted. So thank you again. And this newly minted 70-year-old is checking out. Until next time, ciao.